call the meeting to order. We're waiting for Senator Kirshen. I'm sure he'll be here shortly, but for now, I think we just want to be able to ask some questions. Let's start with the Kni budget. There he is. Had to just act like we were going to go without you. Senator Kirshen, we're going to start with the Kni budget. It looks to me like Kni is not asking for much of anything other than the salary adjustments, and the governor does not recommend. That's not how to get off of that. Are they? I'm getting theirs confused with the stabilization, crisis stabilization unit. Is that request just for Parsons? So they didn't, yeah. So on Kni, salary adjustments, no other requests.
That's correct, Madam Chair. Scott Bruner with the department.
Okay, unless somebody has something else, I am fine with recommending or accepting the governor's recommendation on Kni. Agreement? Okay. All right, then let's move on to Parsons. I didn't understand what's this, I don't know if somebody else might have asked for food too. What's the deal with the food adjustment?
That's only at Larned State Hospital, Madam Chair.
Larned, okay. So then it doesn't look like, so the only thing that they'll be receiving is the salary adjustments?
For Parsons State Hospital?
Or not?
They'll get the salary adjustment as well, and then the crisis, what's in the governor's budget is the behavioral crisis stabilization unit.
So why do we accept theirs and we didn't accept Kni's on the crisis stabilization?
The intent is only to have it at Parsons State Hospital. The Kni, the staffing there, the patient mix isn't well suited for a stabilization unit. Parsons has the staff that are specially trained to work with folks that have an intellectual and developmental disability and some of the more severe behaviors that would want to target. So Parsons is the right place to put that unit.
I know we talked about this the other day. So remind me again why we need this at that facility.
We've heard from stakeholders around the state that folks that are in the IDD system are served in the community, live in the community, receive services in the community, but there are times when maybe their services change, something in their life changes, and they fall down a path where they maybe a mental illness that's newly diagnosed. They get involved with law enforcement because they've had some kind of behavior that raises some issues with law enforcement. Could be a violent act against a family member or someplace where they're living. So they have some disruption in their service. And the IDD system's not well suited to meet those needs. The behavioral health system's not well suited to meet always the needs of folks with IDD. And what they've asked for or what both sets of stakeholders on the IDD and behavioral health side have asked is for a place for people that have those behaviors that need some stabilization to go to get stabilized, to get back on track so they can come back to the community. There's really no level of service like that in the state, and there's a need for it. So we looked at what we could offer as a state agency. The appropriate place to do that would be at Parsons, where they've got that specialized training and they work with folks with IDD that have violent tendencies, sexual acting out, things like that Dr. Dixon talked about. But this wouldn't be intended to be a long-term stay. They'd be
right. So it's like our ComCare other places, but do they not have, in that region, do they not have a community mental health center that can do that? Or where are crisis beds? I mean, that'd be a great thing to see. We requested 3 years ago, we want more crisis beds across the state. So on a map, did we try to spread them all out?
And crisis beds could be part of that solution, but we've heard from both the behavioral health world that sometimes the crisis setting isn't the right place for somebody who has intellectual or developmental disabilities. We've heard from the IDD world that if they had any kind of crisis, they don't really have crisis capacity, but they could use that level of care to get somebody stabilized.
Specifically to that population?
Yes, to the IDD population that maybe has other issues that are disrupting their community services and placement.
So they're asking for 15,000 SGF to remodel.
That was in the current year. I think we're probably far enough into the fiscal year now that we can do that work. If we could get the 23 budget enhancement that's in the governor's budget, we could be close to starting on, or pretty close to start on on July 1st with the fiscal year. There's just a little touch up that we'd need to do to the building that we're planning to use. And then we've got to recruit the staff and build the unit out from there. But I think we're okay not with we asked for the supplemental in the budget process. We're a little further into the year now. We think we can make it without that, but the funding for 23 would let us get the unit stood up and operating.
Do you have the 13 FTEs? Or are you going to have to put out for hire?
We don't have them today. The idea would be we've talked a lot about the mental health disability tech, that kind of entry-level position. What we want to staff this unit with are people who are more experienced than that, still doing direct care, but we call them the client training supervisors, CTSs. So they'd be a little higher skilled, with more training. And so we need the positions. I don't think it's all 13, it's maybe 12 of them that we'd hire as new CTSs, because it's a focused, targeted, intensive intervention for people that would come to the unit. They just need a little more. Again, we don't want to have those individuals stay at Parsons long term. It's intensive stabilization and moving back to the community. So we need a little higher level employee to make that work. Okay. And we don't have the FTE. I'm sorry, I avoided your actual question, but we need the additional FTE as well.
So you're going to take one of those rooms that have already been reconditioned, or you're going to take a room that hasn't been to make it literature safe?
So the building we're intending to use at Parsons, it doesn't need a lot of touching up, but it's designed to serve people that have intellectual and developmental disabilities, so it's as safe as it needs to be for this population.
We're not taking it away from those current beds?
No, they're not. That particular building's not being used today at Parsons.
So the questions I have, do you have any questions about Parsons?
I was just looking at that staff category that you mentioned, and it seems that either you don't have as many CTSs or they've done a much better job of staying, because it looks like that there's only been 2 CTSs that have left over the last 24 months, as opposed to the lower category MHDDTs that kind of just come in the door and go out the door almost, it looks like. There's so many of them, I guess.
A supervisory position that pays higher. There's more training involved in it, so they don't tend to turn as much. And there are, it is a different design for this unit to have it be entirely staffed or primarily staffed by CTSs. That isn't the mix on other buildings at Parsons, so it's a little different.
Thank you.
Any other questions on Parsons? What's the committee's recommendation? You're basically, it'd be the pay adjustments as well as the adding the units for crisis stabilization. We're just talking Parsons. You supportive? Dan, Jean? I don't see a no. Okay. Consensus. All right, let's move on then to start with Lorna, or? I have a few questions on this. Yeah. We'll make all those at the end, so, thank you. We're just trying to figure out how much we got to talk here. Okay, let's start with Larned. And going back and trying to look over all this, the additional funding for contract nursing staff, the governor doesn't recommend. Help me understand the difference between that, and I thought I also heard that they were taking advantage of the traveling nurse money. What's the difference here? A contract nurse and a contract traveling nurse.
They're the same. We do use agency nurses, so I may be confused about what pot. If there's not separate funding for agency nurse. Well, there is a budget in our submission for professional services, which is where the agency nursing paying those contracts would come from.
Okay, I guess I thought there was federal money for that, for the traveling nurses.
Not specifically for Larned. We have used some of the CARES Act and ARPA money that we've received to fund that contract. The costs are well exceeding what we've received from the federal government so far. I don't believe there's a separate pool of money for state hospitals that we could access for contract nurses.
We're the same. That's what I thought. Okay, well, the governor didn't recommend that. And if she did, would we be able to find people to go to Larned?
As contractors or as traveling nurses?
Contract nursing staff, what I'm reading.
We have had luck in using the state contracts for contract nurses. The issue is more that the cost to have those nurses working at Larned to fill in the gaps in staffing is 4 or 5 times more expensive than hiring a nurse directly. And we've had less success in hiring nurses because they can go and work for the staffing agencies and make more than our base pay relative to full-time employees.
Yeah, I was just wondering if you could get people to travel out there. That's all I'm getting at.
That seems to be less of an issue. We've been lucky in I think the number from last month was 74. I think we're maybe up to into the high 80s of contract nursing staff, RNs, LPNs, and CNAs. But so we are able to, or the contractors are able to fill those needs as we ask for them.
Okay. And then talk to me about this food issue problem. Oh, go ahead.
I'm sorry, Senator, I just want to make one additional comment on the contract nurses. You were referring to the 13 million request that we made as an agency. The governor did not fund that in her initial budget because she wanted to get a little bit more year-to-date expenditure experience. We did mention yesterday in our testimony, we do anticipate having a shortfall. And so we will be looking to make a request for a governor's budget amendment. So I just wanted to be transparent with this committee. So we will need, some portion of that. We're looking at year-to-date expenditures to make that request, Senator.
Okay.
So you'll see that in the process.
It'll be a GBA coming later with more information.
Yeah, we would hope so, Governor. We'll make that request, based on current spending patterns, but we definitely will have a shortage. So, thank you.
Now, talk to me about the food service contract. Is the food not any good, or what's going on here?
So last year at Larned, we were the food service vendor for both our hospital and the correctional facility. We used the same contractor, and we supplied the food to the correctional facility. Last year in the budget cycle, we had talked about breaking those contracts up. DOC has a different vendor, and we were going to keep ours, and there was a budget adjustment related to the number of meals that we're delivering every day dropping by 2/3 or something on that order. So when we went back to the vendor and said, you're not going to provide meals to DOC, and a couple of other changes in the contract, we renegotiated the rate. We're spending less than we were before when we were providing all the meals to DOC, but it's a little higher than where we were left in that adjustment. So the $893,000 that we're including both as a supplemental and enhancement is the kind of net of that change in the contract to just provide meals to our patients and some staff. The per meal cost, because the volume went down, the per meal cost went up, and the difference is the amount that we requested in the budget.
So you're not, DOC's doing their own thing,
Yes.
is that right? Okay. All right. On your SPTP safety and security FTEs, there's a security problem. Partially funds this.
Yes. So what we asked for in our budget submission was a couple of things. One is a technology piece for the phone system. We found after we had an escape over the summer that we weren't able to adequately monitor calls that our residents were making outside the hospital. And so we want to upgrade the phone system so we can do a better job tracking those things. The other part is some staffing. A couple of the dynamics that are happening at SPTP are we have to, if we transport people off campus, we're sending a security officer with them. In addition to the techs that would normally work with them, just to provide a higher level of security. And we've had a number of people over the course of the last year that have been in the hospital, and they have to have a security presence with them as well. So we asked for some additional staffing just to make sure we had a more security focused staffing mix on the SPTP program.
On the phones, you just get the old-fashioned one, and the operator listens on the other end. Can you guys not listen?
We'll explore that.
Do you not have a system to where you can listen to their conversation, or is that a privacy act?
There is a privacy concern, and just the phone system itself isn't stable enough to, we just miss some of the things that are recorded. So that's an upgrade across the campus that we think will give us some additional capabilities that would help from a security perspective.
Okay. Any other questions? Senator Petty?
My only question was actually following up on the question that you had concerning the agency nursing staff. So I guess I should ask you, Madam Chair, about since we've heard that would be a request for a budget adjustment, waiting for that as opposed to adding anything or asking for anything added in this budget. At this time, I'm kind of asking you.
I thought you were asking him, so you want to shorten that question?
Well, I see that there's so that 13 million that's in the request that wasn't funded, and Secretary Howard just spoke to the fact that and yesterday we heard, or I think it was yesterday, we heard that the range is from $77 an hour to up to $85 an hour, and that most of them are coming in over $100 an hour because that's the agency's price range. So what you're saying is that you've actually overspent in order to provide coverage. Would this be correct?
We haven't overspent yet, but we're really close to being in that situation. And those rates that the folks from Larned gave you went into effect in January. Those are the new rates. So we do want to get a little experience. So the 13 million that we submitted in the budget in September was based on our experience up to that point. It's substantially different now than it was even in September in terms of the number of agency nurses that we're using and the cost per. So we do want to look at the kind of year-to-date expenditure and get a reset of that number, and then figure out what other resources might we be where we can make it up on our own. But I don't think we can close the. I'm confident we can't close the gap on our own.
So not only, well, and also you shared that there were 74 temps that were used over the month. That would be the
In
month
January,
of January.
yes.
So in January, the agency rates, they increased substantially.
Yes, yes, ma'am.
Along with the needed number.
I think in January, the number was fairly stable from November and December, but the price went up substantially.
Thank you.
Okay, any other questions on Larned? Okay. We'll stick with the governor's recommendation, but we'll come back and vote on that. Let's go to Osawatomie. The Detox Program. I'm trying to figure out, you want $900,000. And how many people are you going to serve?
It's for a dedicated unit with 3 beds. The length of stay is only 24 hours. And we haven't had any admissions yet since we started, made that available at the end of January. So I think our estimate is that we'll have in any given month, maybe 10 to 15 people come in, but they're there for a very short amount of time. It's a pretty, they do, folks that are brought in by law enforcement for social detox, they're going to get a medical exam, they're going to get a nursing assessment, and some psychological assessment as well. So the staffing model that we designed was to have a dedicated team for those folks that come in on those for that social detox service. We can use those same people for other things in the hospital, but so there'd be a dedicated staff for those 3 beds.
How would this be different than our folks just go to the jail and sit? Or can they go to the Osawatomie jail and sit for 24 hours?
They could come to Osawatomie to the hospital, yes, and be monitored while they detox from whatever substance they were on, and then we can do an assessment of whether they have a psychological need or have a mental illness that we could treat. And so after that 24 hours, when their system is cleared, we'll do if we think there's an ongoing need for mental health treatment, we'll go through the involuntary commitment process and get a mental health screen, and then see if we want to move them to the Adair unit for acute treatment or the Osawatomie unit.
I just need you to help me understand. It's a fairness issue for me. They have a hospital. I don't have a hospital. Mm-hmm. So ours go to jail. Or they go to ComCare and lay on the mats. Do they not have a place like that? A jail or a community mental health crisis center?
Not across the Osawatomie catchment area, or not around Osawatomie and Miami County and Franklin County. There isn't.
They don't have a jail. Miami County doesn't have a jail.
They do have a jail. This service was provided before the moratorium was imposed in 2015. And the community, and working with the mental health center and law enforcement, as we've talked about lifting the moratorium, one of the elements they wanted to make sure that was part of that lift and service mix was a restoration of the social detox beds and availability for, if it's somebody who's in if law enforcement can't figure out whether it's a mental health issue or a substance abuse issue, we can at least provide a safe place for that person to
We have
settle
that
up.
same issue. Our law enforcement can't figure it out. So they got to put them in jail or go knock on ComCare's door.
They could transport them to Osawatomie in that scenario. I don't think that's probably as good of a fit, but it does fit the need for the immediate counties around Osawatomie and in that.
I think what I'm
catchment area.
asking is, why doesn't the counties fund some of these programs? Is it just, we've got a state hospital right here, so let's just have the state pay for everything?
I imagine there's a mix. I mean, it is part of the service that was at Osawatomie before, and as we've talked to community and stakeholders and lifting the moratorium, this was a part of what they asked for us as the state hospital to provide back to the communities where we're located. So that's been the mix.
And then the Biddle staffing increase, what, you probably didn't bring me my picture, but
Oh, I didn't.
what,
Apologize.
because I'm trying to remember what it looks like, but I'm trying to figure out what was it used for these services in the past?
So in the Biddle building right now we're only using one wing for patients, the east wing. To lift the moratorium and what you funded in prior years was remodeling the whole building so that we could use both the east wing and the west wing in the Adair acute setting, so we could get it CMS certified and bill Medicare and Medicaid for services to treat people in mental health crisis. And as part of that enhancement from 2 or 3 years ago, there were some initial positions funded at Osawatomie to start building that capacity up. As we've looked at the mix and the design of the building, there's a few more positions that we need to be able to staff it adequately and keep it open. So that's the request that you've got today. So the Biddle building is I apologize for not bringing the picture. It would be we'll be adding 12 rooms on the west in the west wing, and the 30 on the east wing will be touched up a little bit as well. So that is 12 new additional patients that we'll be able to serve, and there's some staffing related to that. That's what the request is for.
Okay. Other questions? Okay, I want to go back to the detox. Why don't we put money into whatever program that is that's statewide detox? That, I don't know, is it DECA, MIR? Just trying to think of some of the service providers. And I'd sure like to see a map of all those people that provide that service across the state. I remember calling the secretary a few years ago, and it was like whoever was needing to go or ready to go, they couldn't get in for 6 months. So my question is, why do we not fund that program that's statewide? Because it's lacking in itself. Looks to me like we're just putting a program there for the community right there in that hospital, while the rest of the community doesn't have that available to them.
It is, since it's short term, the catchment, we'd serve the whole catchment area, of course, for Osawatomie, but the law enforcement, the requests that we've heard from law enforcement are primarily in the counties surrounding where the hospital is. And that's the request that we made to the governor's office, and what we thought the staffing was necessary for that. That's certainly the legislature's decision if they wanted to fund a different way or a broader reach. Maybe the one thing that is different about Osawatomie is that it is a shorter distance than between that person who's detoxing, picked up by law enforcement, and then we don't need to discharge them, send them back to the community to get a mental health screen completed to see if they're going to come back to Osawatomie. We'll wrap that around the individual who's there. That wouldn't happen. That same process would happen to somebody in Sedgwick County, but it does save a little bit of a step if we need to move that person to an involuntary commitment because they're already on the campus.
All right, well, I'm certainly sympathetic to these programs, but with 3 beds, and I just don't feel like I totally understand it. So you guys can vote for it if you want, but I would like to put this off. And I would like a map of the ones that provide 24-hour crisis and the ones that provide, I don't know if they have a 7-day, and I know 30 days is the best, and there's not very many of those. So that's what I'd like to do. Has the House, where's Matthew? Has the House, they haven't done their deliberation yet on this. Okay, all right.
And Madam Chair, I did misspeak. Getting notes from folks at Osawatomie. When we had the social detox before the moratorium, we averaged 117 patients that came through social detox annually. So it was a little bit
For 24 hours.
for 24 hours. That's correct. So a few more than, I didn't do the math. I talked about by the month, but it was 117 over the course, on average for a year before the moratorium.
We can always change this once we present it to the committee of the whole as well. So I need more information, but. So any other questions on this budget? Okay. So I don't think we've made any changes. We've agreed with the governor's budget. But we will have to make a motion to make everything legal. Yes, Senator Petty.
So you had just mentioned your concern, there's a scam call coming in, your concern about the social detox program at Osawatomie, and I'm concerned about the potential overrun on funding for agency nursing staff. So as we make this motion to approve these budgets, can we add to that that when we look at the full budget that we look at those issues?
Mm-hmm.
Okay.
So let's just go ahead. Do I have a motion to approve the KNI 22-23 budget? Motion. Motion by Kirshen, second by Petty. Any discussion? All in favor, say aye.
Aye.
Opposed, no. Parsons State Hospital for 22 and 23. Take the governor's recommendation. Have a motion? Motion by Kirshen, second by Petty. Discussion, seeing none, all in favor.
Yes. I would like to have us in.
Oh, that was in Parsons. Sorry, I was in a different one.
Oh,
Go
no,
ahead.
Sorry, that was Oswald.
That's what I thought. Okay. Any other discussion? Seeing none, all in favor, say aye. Okay, motion carries. Larned State Hospital. I don't think we made any changes to it. So do I have a motion to approve the Larned 22-23 budget? Motion by Kirshen, second by Petty. Discussion.
I would like to see included with the recommendation for the Larned State Hospital that we, at the time of considering the full budget, that we look at funding, increased funding for agency nursing staff.
Do you want to do that when we do the report out, or do you want to do it when we package the budget? So we do report out when, Matthew? I mean, would there be more information available by Tuesday? No. I was just trying to prevent you from having a GBA as well. So my thought was just trying to buy you time. So let's make sure that that's in there when we package the budget, that discussion item comes up. And that'll be around, I think, the second week of March. Okay? And then if we're still not ready to go, then you can do a GBA, but this way maybe we can avoid that. Okay? All right? Okay. Any other discussion? Hearing none, all in favor say aye.
Aye.
Opposed, no. Motion carries. Now we're on Osawatomie. I believe we're adopting the governor's recommendations. And I'll be interested in hearing the House's discussion on this as well, but with the exception of the detox program. And that detox program can come back at any time, either when we report out or when we package the budget, once we have that information. Okay. Was there any other changes for that hospital? All right. Need a motion to accept as amended. Senator Kirshen, for motion second. Senator Petty, discussion. Seeing none, all in favor say aye. Aye. Opposed, no. Motion carries. Anything else come before us? Yes?
Can I just clarify for the Osawatomie, it's to delete the funding for the social detox. And that's the amendment.
But for that discussion to come back, can come back when we report out. If we're not ready, it needs to be on that list for discussion when we package the budget. Okay? All right, I don't see anything else coming for us, so we are adjourned. Thank you all.